My name's Pam Ferrer and I'm a Macmillan Prostate Cancer Clinical Nurse Specialist at Northampton General Hospital. I've been part of the project for the last couple of years alongside my colleagues from Kettering, setting up clinics for patients with stable prostate cancer. Previously, we did some face-to-face wellbeing sessions, but we're now doing these links so that you can access them at any time that you want to in your own time. This is a talk about the management of bowel problems in prostate cancer. We know that patients who have radiotherapy are likely to get problems with their bowels following their treatment. This doesn't happen to everybody, but when you're originally seen by the oncologist to discuss your treatment, then it is likely to be something that you do discuss and that is written into your consent form. Both external beam radiotherapy treatment and brachytherapy treatment may cause problems with the bowel pattern. Radiation causes inflammation to the lining of the bowel, which is called radiation proctitis. This may be a temporary situation, and you may find that you have difficulties whilst you're actually having your treatment, or it may be something that happens in the long term. For some patients, this will be a long time, in fact, years before you start to have any problems. Symptoms can vary from quite mild to severe, depending on your individual circumstances. When you have your treatment, we're also very selective when you're having the treatment on making sure that you don't have problems with the bowel before you have the radiation. Symptoms that you may find that you get are a change to the type of stool that you pass. The stool may become very loose and watery, which is then called diarrhoea. You may find that you get constipated. People vary in how they describe constipation. Some people feel constipation is when they can't open their bowels every day, and some people would refer to it as more related to having a hard stool. You may find that you get some leakage or soiling, which is bowel incontinence, where the feces leaks, and you may need to wear a pad because of this. You may find that you get quite windy or find that you're feeling quite gassy and bloated. You may suddenly get an urgent need to open your bowels and find that you can't leave home in the morning before you've been a couple of times and feel comfortable. One of the things that we need to consider for you is actually self-management. By this, we mean looking after yourself by yourself. Eat a healthy, well-balanced diet. Make sure that when you have your meals, you are actually having a full quota of protein, carbohydrate, and vegetables. Drink plenty of fluids. It's important that the amount of liquid you take during the day is between 1 litre and 2 litres of fluid. Reduce the amount of fibre that you take, as this can exacerbate diarrhoea or wind. So if you're having this problem, cut back slightly on the amount of fibre that you're having. Gentle, regular exercise is good for you and will also help with the bowel pattern. Take regular walks. Keep your weight at a regular, healthy level. Don't allow yourself to become overweight or underweight. Prevent yourself becoming constipated. If you have a regular bowel pattern each day, then this will help the discomfort. Consider how you sleep and whether you're sleeping sufficiently well. Consider also your mood, as this may also have an impact. All of the things about managing these are beneficial for your overall well-being. Fluids, as I already mentioned, you would aim to be drinking between 1 and 2 litres each day. This is between 2 and 3.5 pints. It doesn't really matter what you drink as long as you're having liquid, but water is the best thing that you can have. Drink smaller amounts during the day. You don't need to drink a pint of liquid every half hour, but have small drinks with your meals. This allows you a bit of space to put the food in also. For some people, fizzy drinks can make the bowel problems worse. Things that have sweeteners in may affect the bowel pattern and also affect your waterworks. So caffeinated drinks such as tea, coffee and cola can make a difference, as can alcohol. Some people find that when they have their regular pint of beer, it actually keeps their bowels regular, but this isn't the case for everybody. Look at what you're eating. If you are suffering from constipation, you need to increase the amount of fibre that you take. Fibre is contained in whole grain breads, cereals, pasta, fruit and vegetables. Your vegetables are better if they are raw and unpeeled. Nuts and seeds are good. Legumes and pulses like baked beans, lentils and chickpeas can help to stabilise your constipation. Have a fresh orange, an apple, a pear. And prune juice can help as well with the constipation. If you have a diet that is heavy in fatty foods like fried fish, fried chicken, French fries, or high-fat milk products, this can be detrimental to keeping your bowels moving. So try and eat less of this. Try and have your meals on a regular basis. So breakfast is a regular meal in the morning, you have a lunch and you have a meal in the evening. This helps to stabilize your body and so helps with your digestive process. If you suffer from diarrhea, drink plenty of fluids to prevent yourself becoming dehydrated. If you have a lot of water, that will be better for you, diluted with cordials if you can't tolerate water, and these will hydrate you rather than high sugary drinks. Alcohol and strong caffeine can actually reduce the amount of liquid you have in your body and can make you more dehydrated. So this may in turn also worsen your diarrhea. Avoid very high spicy foods and fatty oily foods, as they again may exacerbate your diarrhea. Rehydration drinks that you can get from your pharmacist can be beneficial, things like Dietary, but always consult the pharmacist as to anything that you're going to try to take to see whether it's something that you should be taking. But they may help to replace the salts that you're losing in your body. Sometimes you have a temporary intolerance to lactose. This is the sugar that is found in milk, and fructose that can be found in fruit can also cause diarrhea. It may be worth considering the type of milk that you drink and swapping to an alternative such as soy milk or almond milk may be worthwhile looking at, and low lactose milk is beneficial to drink until the diarrhea settles. Sometimes you will have to resort to using a medication to improve the symptoms that you are getting with the bowel. If you are constipated, it may be worth discussing this with the pharmacist or your GP and trying a laxative. Stool softeners can help to maintain your bowel action on a regular basis, and you may need this just for a short period of time. But be aware that sometimes these can also give you a feeling of bloating. Anti-diarrhea medication can reverse your diarrhea. Drugs like loperamide, the other name for which is Imodium, you can get the little Imodium instant tablets, and sometimes these will help, provided it is not an infective cause. Bismuth subsalicylate is another tablet. Kaopectate and Pepto-Bismol are all things that can help to reverse the diarrhea. Some of the things that you would have used in the past, so kaolin and morphine would have been drugs that we use, are not the drugs of choice these days, but may still be things that you would want to try. Thank you for watching. If you have any further questions at all, please do not hesitate to contact us at any of the telephone numbers that are shown on the screen.